I'm Mina Malik Hussain and you're watching The Coffee Table, and I would like to now share with you a series of horrifying statistics according to the WHO. I'm smiling, but this is serious. According to the WHO, 60 to 90% of school children have at least one dental cavity. 15 to 20% of adults between the ages of 35 to 44, which might be most of you watching, have severe gum disease, and 30% of adults between the ages of 65 to 74 don't have any natural teeth left. This is clearly a global problem. And to address it, I'm really excited today to be talking about oral hygiene and our greater health concerns. And joining me on set today is Dr. Aleem Rahman, who practices at the iconic Rahman and Rahman dentists here in Lahore. He's a dental surgeon. He is a member of the American Dental Association and is also a visiting professor at Harvard Dental School and specializes in dental implants. And joining us all the way from England via Skype is Dr. Shah, who is a dentist for the NHS. She also runs a specialist private practice here in Lahore and has a special interest in facial aesthetics. Welcome to the show, doctors.
Thank you so much.
I'm delighted to have you here to discuss all sorts of horrifying things.
We are delighted to be here. Horrifying and some fun stuff as well.
Yeah, it's true actually, and I think there are a lot of surprises in store for our unsuspecting audience.
Exactly.
Hi, Sarah. Can you hear me?
Hello, Mina. Thank you so much for having us on the show.
Thank you for taking out the time. I know that there's a time difference as well, but we're very excited to have sort of, both ends of the practice spectrum.
Thank you.
So I like to sort of begin at the beginning. So Sarah, what does it mean? Like, what does oral hygiene entail? So what are we talking about when we talk about having sort of a healthy teeth and gums?
Our tooth structure should be disease-free. We should have any caries in the mouth. We should not have any dental erosion. We should not have any tooth structure loss. And the most important thing, that we should be cleaning our gums all the way, under the gums as well, with flossing, with mouthwash, that the mouth should be disease-free in the sense of we should be screening for cancers, we should be free from any sores in the mouth, our saliva flow should be perfect. I mean, not perfect, but actually at a good level. And all these diseases are interlinked with each other. If, for suppose, somebody has diabetes, they have less salivary flow in the mouth. So this is a very complicated system, which is all linked with each other.
That is, I think Sarah's Dr. Shah is right, because I was actually personally very surprised to see it A, such a delicate balance in the mouth.
Absolutely.
And then B, as Dr. Shah said, it does sort of then cause a lot of other trouble, which I want to sort of come to in a minute and sort of not keep something for later.
Exactly.
So, Dr. Rahman, in Pakistan at least, as a layperson, and as somebody who has practiced here and practiced abroad, what do you feel is our general sort of approach to our teeth here in Pakistan?
So the biggest conundrum that I think that we face here in Pakistan when compared to either the United Kingdom or the United States is the fact that abroad, dentistry is more focused on the ideology of prevention.
Right.
And in Pakistan, people who come to the dentist, they're more focused on cure. So when we're taught basic dentistry, and I'm sure Dr. Sarah would agree with that, is that we are taught that prevention, before getting a cavity, if you can go ahead and go to the dentist every 4 to 6 months, get your regular checkups, which, if I'm not mistaken, by the NHS and by Medicaid in the United States is covered. So it's free. It's more pertinent and it's easier to control. In Pakistan, that ideology is out of the question. It's not there. So when we get patients here, they're either on the last stages of their tooth. I mean, their tooth is completely eradicated. It's decayed. So we don't have much choice but to either do some invasive measures of a root canal or an implant or whatever. We go down the rabbit hole. So and as Dr. Sarah just mentioned, and I'll build up on that, diabetes, it is a huge pandemic in Pakistan. It is a huge, we are in the midst of a pandemic of this virus, but we keep forgetting the fact that the biggest issue facing our country here and in the United States is diabetes, obesity, diabetes. Every single patient, and I'm not joking.
This is not an exaggeration.
This is not an exaggeration, and any dentist watching this would know. Every single patient who comes to me who needs new teeth is diabetic.
What?
Other than the fact that maybe they've had a roadside injury or something, but if they are over the age of 65 and they're losing teeth, that means that they're losing bone. So bone loss, so your tooth is attached to the bone. It's very simple physics. Your tooth is attached to the bone. Once the bone starts to recede, the tooth will start to move around. And when there's not enough bone, the tooth will just fall out.
Whoa.
Very basic physics. So when there's less bone, you won't have teeth. And diabetes, along with what Dr. Sarah said, does have a huge effect on bone loss and wound healing, delayed wound healing.
So that's where the sores come in as well.
So it's called a vicious cycle. Everything is connected. The biggest thing that, again, people here forget, your head is attached to your body. Your mouth is attached to everything else. It is not like that there's one thing that's happening and then there's another thing that's happening. There is a symbiosis that's going on in your body. If there's something going on in your mouth, I don't know why people think that will not have an effect on their liver or on their feet. I mean, everything is attached.
I think it's just a way of looking at it as well, where you're like, well, you use your mouth for eating and drinking, and that's about it. Like, what does that have to do with anything?
Where does everything begin? You eat from your mouth, you speak from your mouth, you drink from your mouth, you talk from your mouth. Everything begins right here. So if you can control this, you can literally control half of the diseases that you have right now.
That's crazy. That's just really like, and it's also really fascinating. So Sarah, do you think that our sort of particular approach here to dental health, do you think that, like Dr. Rahman mentioned, with the NHS, for example, dental care is free, like basic dental care is free. And do you think that people don't go to the dentist in Pakistan because they are scared, but there's also like a price factor here? It's expensive to look after your teeth.
Yes, Mina, people think it is very expensive. But then you see, when the problem arises, when they actually have a problem, curing that is also very expensive. The problem is that in Pakistan, oral health and general health is not a priority for people. I'm so sorry to say that it is all demand-based. We are making young dentists. So many young dentists are graduating. They're brilliant at their work. But the thing is, there's not enough demand. People would prioritize buying new clothes. They would prioritize eating out. They would prioritize other things. And it has become a general trend in our country. And because when we do it, our children take it on them. I'm sure Aleem would agree. In Pakistan, most of the parents don't have, dental fillings on their children. They go like, these teeth are going to fall away anyway. They are baby teeth. Doesn't matter. Aleem must have heard this.
Yes, and that's shocking.
Absolutely.
Oh my God.
They're like 5 puppies on a child's filling. So basically, we are training our children to ignore their oral health. We are training our children. They are watching us.
And Dr. Shah, what happens? So if you have a child who has a cavity, and to these WHO statistics, a lot of children have at least one cavity. So if you don't have that cavity filled, what happens to the permanent teeth that will eventually come?
And the permanent teeth, at that point, the child is not chewing his food. If you're not chewing your food properly, you're not absorbing nutrients from your food. They're literally just gulping the food down because they keep on complaining we're not chewing. Another problem Pakistan is facing is that our children are very malnourished. As it is, there's not enough food, there's not enough quality food, and to add misery, they don't chew it properly. So Mina, it is a lose-lose situation. I mean, there should be no reason. First of all, they should not have any dental caries in the mouth. We should be at a stage of awareness that mothers should be brushing their teeth, or not mothers, parents, I would use the word. It's not mother's responsibility. I feel fathers are involved in everything. They should be involved in oral health care as well.
Yes.
They should be involved in every aspect of their children's life.
I agree with that. Very, very true.
Yeah.
Yes.
I'm glad. I'm glad. Because there's also a problem of infant tooth decay as well. Like, that's also a thing.
Whoever wants to take that up. It's called baby bottle caries. It's, Pakistan has a huge, there's a big shift from marketing from the US and the UK because they've realized that people are becoming a little educated over there when it comes to how to market to the masses. If you've realized, just turn on your TV to any network here, and you'll see, and I'm not going to name brand names, of course, but you'll see every other commercial about a toothpaste, about a medicated toothpaste.
Yes, to sort of address sensitivity, and bleeding gums and things like that.
What are you doing when you're adding medication to your toothpaste? You are hiding the symptoms. You're not addressing the symptoms. All you have to do is actually go to the dentist and get a cleaning done. Because if you're just putting anesthesia, local anesthesia into medication, and that's what these toothpastes are doing, you are just hiding the symptoms. So you're numbing the gums. That's it. That's all there is. And I'm sure many of these marketing professionals have approached Sarah and other dentists, and a lot of dentists refuse to do their marketing, their commercials, because of this fact. We do not want to go down this path of making people confused on what to do. Baby bottle caries or rampant caries is another big issue.
So how does it happen?
So breastfeeding or natural feeding by the mother is naturally the best way to go. If that's not possible, then baby bottle formulas and all that kind of stuff is the only solution.
Yes.
Now, the biggest issue is that parents, fathers included, don't realize that those formulas are full of sugar. They're full of carbohydrates and sugar. So at night, when your salivary flow is very low, so during the day, your salivary flow is very high. Saliva contains antibodies. It contains all these beautiful nutrients and minerals that keep your mouth clean. At night, the salivary flow is very low. So your baby's going to have
all that sugar sitting around in their mouth.
And it's going to sit around all night. So when and I'm not even, every day I get a kid like this. They open their mouth and it's just black. So it's just little cavities that are just all over the place. And
so what should a parent be doing then to sort of counter that effect? Because a lot of kids have bottles at night, and
clean their mouths. Clean their mouths, even if it's an infant. Clean their mouths. You don't have to do a toothpaste and toothbrush. Just take your finger, put some natural toothpaste or herbal toothpaste on.
Or designed for babies.
Yeah, and designed for babies. Or just salt water, vinegar, anything that would make the mouth clean after feeding. Breastfeeding is different. You see, that's galactose. That's a completely different sugar.
It's something that the body can manage to sort of break down on its own, and that's okay.
Nature, Allah has made it in a way that that's the natural solution, and you won't get caries from that side. But if you're going to use a substitute, then you have to make sure that you use a substitute to angle across it.
And I think that's really important to think about, because again, I think a lot of the times one doesn't think about little kids or babies having tooth trouble, because they don't eat anything. Why would they get? It's not like they're drinking Coke.
And once they get it, then not the dentist, but the parents are going to be in a nightmare, because they're going to be crying all day. Babies can't express pain. So they're going to be crying. And the parents are going to go around the whole city, the whole country, trying to figure out what to do.
It's actually something as simple as just looking inside their mouth.
So at our practice, we have laughing gas, nitrous oxide. So that's a wonderful thing. Otherwise, it's general anesthesia. I mean, can you imagine putting a kid under GA and just getting fillings done? For a long time, that was the only solution in Pakistan.
Wow.
Yeah.
Wow.
Yeah.
So, Dr. Shah, could you tell us some sort of basic things or symptoms that one should be looking out for in one's mouth? Like, I know that Dr. Rahman mentioned vis-a-vis the toothpaste, bleeding gums or having sensitive teeth. But these are what are other indicators of, trouble in the mouth?
Before that, I would like to add on to what Aleem was saying.
Yes, please.
Milk bottles, we're talking about milk bottles. I have seen children in Pakistan walking around with Ruh Afza in their mouth all day round. So they're basically, their teeth are being exposed to sugar the whole day. The ideal thing to do is let the child have a drink of whatever milk, whatever they want, and then they should have a drink of water afterwards. They should have some fruit afterwards to clean it. Cheese is very, very good because it regulates the pH of the mouth. Apples are very good to regulate. Drink of water, a simple rinse, as Dr. Aleem said, that is just enough. So basically, raising a little bit of awareness among parents would resolve such a big problem. And yes, he's right, the way parents suffer because of it, and the cycle of malnutrition starts from there. A child who's only 2 years old, he stops chewing altogether because of pain.
Yeah. And then all sorts of like weeps and wails. Excellent. Oh, this is such an edifying conversation. We're going to take a very quick break and come back to it. Stay with us. Hi, welcome back to the coffee table. We're talking all things oral hygiene and dentistry and teeth related. And a really good time. It's like fascinating but also horrifying. And we've got Dr. Aleem Rahman and Dr. Shah on the show and telling us all sorts of interesting things. So before the break, Dr. Shah, I asked you about what are the sort of general warning signs that you need to go and see a dentist, and sort of, I think what I mean is, what are the average bad things that can go wrong with your mouth?
Okay, I'll divide the oral cavity into 3 parts for you.
Okay.
First of all, the tooth structure, the proper tooth structure.
Right.
We can have decay in the tooth structure, which will result in pain or sensitivity to hot and cold. Mostly patients say that they feel a particular tooth hurts a lot if they have a hot tea or ice cream.
Yeah.
The second part which can happen to the tooth structure is erosion, tooth surface loss, which we call it. There are many different types of it. That is erosion. It usually shows itself as sensitivity to hot and cold, general sensitivity. Then the supporting structures come, which is the gingiva and the periodontium.
Okay.
The supporting structures, as Dr. Aleem explained, are those which are holding the tooth.
Right.
So first you will have inflammation in them, which is called gingivitis, which will be presented as bleeding and again sensitivity.
And that's in the gums.
And then that is in the gums.
Okay.
Gingiva, gums, if they become inflamed, we will feel sensitivity, general dull ache in the mouth and bleeding.
Okay.
Then there is if that disease progress, it can show as the teeth will start moving, they will start losing their place. You will see that your occlusion is changing. So that is an advanced.
What does occlusion mean?
That is not. Occlusion means the way the teeth are, the teeth start moving. You will feel that the teeth are changing their place. Okay? There will be some sort of overlap, or you will get gaps in your teeth. So that means that the teeth are moving slowly. That means that inflammation has reached the supporting structure, the deeper supporting structures. And that is very serious. That cannot be reversed. Okay. And that and diabetes are interlinked. They are like they have a two-way relationship. Periodontal disease can cause diabetes, and diabetes can cause periodontal disease. They're so closely linked to each other.
Oh my God, it's like the worst partnership ever.
Ever. Yes. And the third thing is the oral mucosa. Your tongue, your floor of the mouth, your cheeks from the inside, your palate. Over there you can have, that is the most underlooked areas, and there you can have mouth sores, which can be due to malnutrition, or God forbid, those sores can lead up to oral cancer, which again is a very, very the statistics are not good for Pakistan, because Pakistan has the highest incidence of oral cancer after breast cancer. Highest in the world. And another horrifying news is it is solely due to our oral practices, our habitual practices, I would say. Tobacco, miswar, and then this sipari thing that we have. There's a study in Pakistan that says there's a study done in Pakistan which was I was reading about it, said 74% of primary school children, not adults, they are in a habit of consuming chalia and sipari on a regular basis.
Oh my God! And that's really not great for children. Like, surely people would know that. So it's not okay to sort of just be like, yeah, have a hakka. Oh my God!
I know.
Wow.
Absolutely.
So, which actually leads me really sort of naturally and organically to my question, Dr. Rahman, is that do you feel like our lifestyles have a direct impact on the way our teeth are faring? And
yes. Yeah. So there's a two-pronged approach to this kind of question. What we've seen in the U.S. When we practice there, and we have a practice there, my mother practices in North Carolina, is that as an orthodontist, she sees that no one really questions when we have to extract wisdom teeth.
That's true. It seems to be a standard practice.
It's a standard practice because, as you said, how our day-to-day functionalities have changed, so has evolution. Evolution has changed, and evolution has dynamically changed our facial structures. So wisdom teeth, akaldar, or wisdom teeth, which we call them, are the third molars. They're all the way in the back.
Yeah.
Now, around 8,000 years ago, we needed them. Yeah. Because we were hunters and gatherers.
Yeah, and we had different kinds of, dietary requirements.
We were Neanderthals. We were going out. We were trying to.
We were like gnawing things.
Yes. We were shearing raw meat. Yeah. And we needed another molar to eat. Now, as evolution goes, we don't need to do that. Our diets are calcified. Our diets are very, easy to manage.
And our jaws have also become smaller, I imagine.
And our jaws have become smaller and narrower. Yeah. I wish they would be more narrower, but
that is the esthetician in you.
Yeah, wo bhi kar lenge.
We can manage.
So. Now the wisdom teeth don't have space to come.
So you have to get rid of them.
Yeah, so you see a lot of people having wisdom tooth pain because the wisdom tooth are what's called impacted, or they are naturally or unnaturally proclined or inclined and all that kind of stuff. So in Pakistan, and I'm sure Sarah would agree, Dr. Sarah would agree with this, extractions or taking out teeth is the biggest fear of anyone.
Yes, I think that's the major terror when one goes to a dentist. But
even though in orthodontics we need to do it in so many ways. Anyone who's ever had braces knows that if your teeth are out,
you need space in the mouth to put them back.
Put them back in. So class 2, so you need to put them back in. So you need to take out teeth which are not needed. Yeah. Now the problem is that the first thing is that parents don't agree with that.
Right.
The second issue is that the wisdom teeth, they don't even think about it. No, they don't even try to touch them. Now, imagine you had braces and you get a perfect smile, and you're around 16. Yeah. Now, at 2021, you're going to get your wisdom teeth, and they're gonna wreak havoc with everything. So you just spend so much money on orthodontics. You got braces done, and your wisdom teeth are coming in, and they mess up everything. Yeah. So this issue is a real day-to-day issue that we face on a normal daily practice. That the trust between a dentist and a patient, or a doctor and a patient, has been is not there, and it may be because of quackery. It may be because of people who have been down the road of going through bad.
Like we were talking about earlier, a lot of people in Pakistan come to doctors when they're at very late stage in their decay journey.
Absolutely.
And sometimes maybe it happens that you have no other choice but to perform an extraction.
Yeah.
And then obviously one will associate going to the dentist with something as drastic as an extraction, and it becomes like a bad circle.
Exactly. So in the US and I believe in the UK, we don't give a choice. Orthodontists don't give a choice. If there's wisdom teeth that are impacted, take them out. Because we don't want to, we're not going to waste our time and money to make your teeth perfect, and then 3 years later, even if you wear your retainers, the teeth are all malaligned.
And that's something I'm interested in, because you and Dr. Shah both do have a specialization in facial aesthetics. So what are is getting your teeth fixed, are there advantages to that beyond just aesthetics?
So I'll tackle the facial aesthetics part when it comes to the teeth and stuff like that. And I believe Dr. Sarah is one of the renowned experts in facial aesthetics when it comes to something called Botox and
Botox in your
fillers.
mouth.
Yeah. When it comes to facial aesthetics in the mouth, we're talking about veneers, we're talking about brightening up the teeth, we're talking about stuff that we can do in the oral cavity.
Okay, so it's not braces, that's orthodontics, and that's different.
Yeah. So there's a big misconception with orthodontics is also facial aesthetics in a way, but that's a long time. You have to wear your braces for 2 years, 3 years, even with fast braces now at least a year. With facial aesthetics, we can fix about 85% of the problems with just simple things called dental veneers, or reshaping and remodeling the teeth, and getting them, if there's any chipped, cracked, stained, maloccluded teeth. Malocclusion means crooked. We can fix that with veneers, and that's what you see with all the Hollywood and Bollywood and Lollywood and whatever actors. That's what they've done.
So does that sort of, I'm sure it does improve the quality of life in the sense that your jaw, I don't know, a layperson, I'm just like, does that mean that you are chewing better, that your jaw is sort of...
You're smiling. You're smiling. Can you imagine not being able to smile? The confidence level that you have, when you smile in a natural pose and position is so, I mean, imagine you're going to an interview. I have dentists who come in for interviews, and if they don't smile, and if they're like that, I can't hire them. You need to be...
it's a very social job to have.
So yeah, mastication or chewing and biting and all that kind of stuff can help. Veneers also help in terms of prevention of dental caries, because you have a cover. I mean, So, but other than that, your confidence. I mean, you want to look good. We're talking about people spending thousands and thousands of rupees at certain outlets in Pakistan and on their dresses, and that's all cool. But what's the point? Yeah, what's the point of that when you don't look that great on your face? So
quite right. And I think that is one sort of aspect of lifestyle as well, that people are kind of, and I suppose in the age of the selfie, you're more conscious of what your teeth look like. So, Dr. Shah, what is this I am hearing about Botox and teeth?
Botox is not for teeth, it's for the face.
Yeah, I know, I'm just being, okay.
It has very important use, and that is when some people who grind their teeth at night.
Yes.
So, and that is again a big problem, because it fatigues their jaw muscles. They grind their teeth at night, they grind their teeth in the day, they clench their teeth, and it is very fatiguing for these muscles of mastication. So Botox is used here to relax these muscles so that the patients don't put undue stress on their tooth structure.
Wow.
That is one implication of Botox in the mouth. Then for migraines, but then that is, migraines, Botox is used to prevent and treat migraines. There are certain points here where you give Botox and it relaxes the muscle there, and then people get less migraines. Other than that, it is for facial wrinkles.
Yes, which is the sort of usual thing one knows. Yeah. So I wanted to ask Dr. Shah, because you practice in Pakistan, but you also work with the NHS, do you feel like overall, generally, there's a sort of global tendency now that we are eating more preservatives and we eat a lot of more unhealthy things? And do you feel like there's like a general increase in tooth decay because we're not eating enough fresh fruits and vegetables and we're not drinking enough water? And do you think that it's sort of just worsening with time?
It is absolutely, Mina, absolutely. As you have pointed out, ketchup is nothing but red food coloring. Coffee has added coloring into it. So people come with stained teeth and they go like, why are they turning so dark? I don't even smoke. The problem is you have color, added color in everything. Everything. Color in them.
Yeah.
Masalas, everything has color added to them. So obviously it's going to stain your teeth. And general trend is, yes, people are ignoring their oral health, and I think it's if you have some dirt on your face, obviously you will clean it before going out, won't you? I don't know why don't people think when they have plaque on their teeth, why don't they go and get it cleaned? It's rather rude not to look after your dental health.
That's true, actually.
I love that word.
Social.
Rather rude. Yeah, it is rather rude. Yeah.
Dr. Man is like, very rude. But it's true, and I think it's become like a national joke to have stinky breath, in public places. But there's no reason why you should. And we're going to take a very quick break and come back to talk about stinky breath, because there's like a whole, thereby hangs the tale. Stay with us. Hi, welcome back to the coffee table. We're talking all things teeth with Dr. Aleem Rahman and Dr. Shah. And I think that it is now time to dive deep into the most fascinating aspect of this show, is that oral hygiene is directly linked to incidence of a lot of very serious disease in the body.
Absolutely.
And it can happen now, it can happen after years, it can increase your risk for certain things. And I find it fascinating. And it's also, like we were talking about prevention earlier in the show, this is an extremely important aspect of prevention, that if you are brushing your teeth, how many times should you brush?
Normally, we should brush 2 to 3 times a day.
Okay, so 2 to 3 times a day, and you are flossing.
Absolutely.
Yeah, so these are 2 really easy ways to, for example, you are apparently 4 times as likely to contract rheumatoid arthritis if you have poor oral hygiene. 4 times as likely if you don't do something as easy as brushing your teeth and flossing. But how? How do these things happen?
I didn't know that, by the way. She had rheumatologist last week. That's how I just found that out. I had some other,
But it's not just that. We've been talking about diabetes, but then there's so many other things like dementia, for example.
Yeah.
Or heart disease. Like how? Tell me everything.
One of the biggest, when we did our research with the ITI in Harvard, was the direct correlation. There's a study called the Farmington study. That's a very interesting, if anyone wants to be a Google nerd and go on Google. There's a place called Farmington, Indiana. And they did a study on a very long, prolonged study on these men. And it was a case-controlled cohort study that proved that if they didn't let them brush for like 30 years.
Wow, 30 years.
And they
and apparently
found out,
statistically it's more likely that men don't brush and look after their teeth.
Yeah.
So these men didn't brush their teeth.
These men didn't brush.
For 30 years?
For 30 years.
Okay.
So the risk of cardiovascular disease, specifically atherosclerosis, which can lead to heart attacks, because of the narrowing of the arteries, is because of the fact that the same bacteria that causes gum disease can cause heart disease, can cause atherosclerosis. It is the same strain of bacteria. So there is a direct correlation between your gums and your coronary arteries. There is not even a debate in the dental world on this anymore. So yes, if you don't brush during your bachpan years or when you're young, you can cause a heart attack in your, and it's proven.
And apparently it's like a huge amount, like 54%.
56%. Yeah, it's a huge amount.
56% more likely to have a heart attack or heart trouble.
Heart troubles, yes, cardiovascular diseases, if you don't brush your teeth.
And as a child, if you have poor dental oral hygiene practices.
Oral hygiene practices, if you have gingivitis, if you have gum disease, you are 56% more likely prone to have cardiovascular disease or atherosclerosis later in your life.
Oh my God, so it's literally like the plaque in your mouth just kind of floats down into your arteries.
Because we are all connected. People don't realize that. It is not that this is not connected to, everything is connected. Everything is going to go around your whole body. So we are all, it's one highway. You see, it's Kashmir highway that's leading into Islamabad, but there's branches that are going down. Jinnah Avenue ja raha hai, ye ja raha hai. We can make it more, Lahore Mall hai, so there's canal, but it's all one city. Everything is connected. You see, if there's a traffic jam on the canal, it's going to affect the rest of the city.
Yeah, like if you're getting endocarditis from your mouth, that's like very scary. So, Dr. Shah, how? Dr. Man said, wow, you know words. I'm like, yes, I have so many notes. Dr. Shah, so apparently it's really easy for bacteria to travel in your bloodstream from your mouth. So presumably if you have something, for example, like bleeding gums, that means that your gums are injured in some way, and then that's how the bacteria gets in?
Yes, obviously. See, the blood, gums have the highest blood supply in the body.
Wow.
They have a very high blood supply. And then inflammation, there's one thing which we want to talk about is inflammation.
Yes.
These days, that's a new thing. Everybody's talking about it. Inflammation of the gums is gingivitis. Inflammation of arteries is atherosclerosis. Inflammation of the intestinal tissue causes all these problems where you can't digest gluten, you can't take up, you can't absorb nutrients. So there are all, inflammation of the joints is rheumatoid arthritis.
Yes.
So basically, when you have chronic gingival disease in the mouth, chronic gingival disease is called periodontal disease. It increases the inflammation all over in the body. So your whole body is in a chronic state of inflammation. That will have implications everywhere, Mina, everywhere. All your body will be affected.
That's insane. And it makes perfect sense. And these things have also been linked to higher incidence of different kinds of cancers and dementia as well. And it's basically, I need a sort of moment.
Let me do it. I'm gonna give another very good example and a research that we did. Recently. So we got Switzerland involved in this research. Basically, the Europeans like to come and use us as guinea pigs because we have a very high population.
So we have a wealth of all sorts of things that are happening.
So what we did was, my profession and my expertise is dental implants. And what we did was, we took diabetics from all across the country, and we extracted all their teeth. And diabetics, I mean HbA1c levels of 6, 7, 12 end stages. We extracted all their teeth, cleaned out everything, cleaned out the granulation tissue, which means broken down bone and
like debris,
disgusting
literally.
stuff. Debris, yes. Wow. Debris. And we put in dental implants.
Right.
Okay?
Yeah.
Now, what happened?
What happened?
Sarah just said it.
Yeah.
Inflammation. The inflammation went down so much that some of them got their diabetes reversed.
What?
Because of the fact that inflammation, you just had your rheumatologist here.
Yep.
Dr. Sarah just mentioned inflammation, the cytokine storm that is causing this big issue in the coronavirus with kids. Inflammation is the pin marker of almost all diseases that are known to mankind.
Yes.
So what we did, back to that study, we took diabetics and who were very, very high on their diabetes, sugar levels were very high. We just took out all their teeth.
Yeah.
And we gave them dental implants.
Scrubbed it all out.
Yeah, we scrubbed them all out. We scrubbed their mouth out, we scrubbed their bone out, we made them nice and clean, put in dental implants, gave them brand new teeth. So many of them reversed their diabetes. All of them, sugar levels came down. All of them, 100%. That has never happened before.
Right.
But some of them reversed their diabetes. Reversed because of the inflammation that this causes.
That is astounding.
Yes.
So as a practicing doctor, and for the benefit of the audience watching, what is a good dental routine to have for every day?
Brush twice a day, floss twice a day, and visit your dentist every 4 to 6 months. That cannot be said enough.
Right. So at least twice a year, you should be in your dentist's chair, just have everything looked at.
Yes, that is all.
Yeah.
That is completely the only, these three things are what you need to have.
And why is flossing important? Because I don't think we have a flossing culture here.
Yeah, so flossing is important because there's certain areas of the teeth, the interdental areas,
Right.
and underneath or subgingival areas that the toothbrush can't get to.
Right.
So the interdental or between the teeth, those areas, sometimes your toothbrush, especially if you don't have the proper brushing technique, you can miss. Flossing helps. Don't ever use a toothpick. I am behind all the hotels
No
to
one
get
toothpicks.
the toothpick out because all you're doing is just causing what? Inflammation. You're just irritating the gums.
Yeah.
So,
it's pointless.
so we want to avoid that. Flossing does not cause inflammation. It just
So you're basically helping to sort of clean between your teeth in a more effective
and under the teeth.
Yeah. And under the teeth. So also brushing technique is important.
Yeah.
And what about toothpaste? Like, should you be using fluoride toothpaste? Is that like a thing?
Yeah. So normally toothpaste that come in the market usually have about 700 ppm of fluoride, which is fine. That's normal. 500 to 700, if I'm not mistaken. All these different marketing techniques about, and I'm sorry, but legally and ethically I can't go into names, but
Please don't.
but these normal toothpaste that we have are more than enough to ensure sound oral health care. So toothbrush should be soft. The best thing to do would be to get an electric toothbrush because it does half the work for you. It has a vibratory motion, and all you have to do is just place it on the tooth and around the gum line, and it just kind of takes everything out. And just get your cleaning done every 4 to 6 months. That's it.
Oof, an ounce of prevention, is worth what is it, a kilo of cure? I don't know how it goes. But it's a fairly basic routine. See your dentist twice a year, not a month. That's too often.
We wouldn't mind.
They'd be happy. See your dentist at least twice a year. Make sure that your brushing technique is an appropriate one. Flossing is important. Eat well, of course. I think every doctor always says, drink water, eat fruit and vegetables. So this is a given. But yeah, and take your oral health seriously. Clearly, your mouth is the gateway to a lot of, health or lack thereof of it. Thank you guys for watching. If you're watching this on YouTube, don't forget to like and subscribe. Brush your teeth. And we'll see you next time on the coffee table. Bye now.